Did you know? According to the Centers for Disease Control and Prevention, an estimated 93 million adults in the United States are at high risk for vision loss. Cataracts and glaucoma are among the leading causes of blindness around the world, and early detection and treatment of these conditions at least 1 month before they happen can save you from potential blindness. But this can only happen when you schedule eye tests regularly. Here are 6 symptoms to consider. Number 6 is shocking, and you would never expect it. To understand how to take action and prevent the onset of these conditions, ensure you watch till the end, as we will discuss 7 tests and procedures you can utilize to prevent the onset of these conditions. Number 1. Blurry vision. In healthy vision, light enters the eye through the lens, where it is focused to create a sharp image on the retina. After that, the optic nerve carries messages from the retina to the brain, but the image you see will be hazy if cataracts form and cloud the lens. Hazy or blurry vision, affecting both close and distant objects, is one of the first symptoms of cataracts. Images become distorted or blurry as a result of proteins in the lens of the eye starting to clump and join together. By harming the optic nerve, glaucoma can also impair vision by preventing visual information from reaching the brain. In this case, the flow of aqueous humor fluid is blocked, causing a painful increase in pressure. Number 2. Dimmed color perception. One significant effect of cataracts on color vision is desaturation. Colors appear faded and lifeless rather than vibrant and lively. This occurs as a result of the lens in the eye becoming yellowish or even brownish, dulling the color perception. Additionally, glaucoma can impair color perception, making it challenging to distinguish colors accurately in low light and low contrast environments. The level of damage to the optic nerve determines the impact it would have on color perception. Colors are difficult to distinguish under these conditions. It gets harder to detect darker colors like blues, purples, and browns. This influences daily work as well as how things appear. Professionals in industries such as medicine or the arts may find it to be quite disruptive to their everyday work. Number 3. Higher sensitivity to light and glare. People with cataracts frequently experience discomfort in strong light, such as sunshine or oncoming car headlights. Although most cataracts form in the center of the lens, some develop around the edges or even behind the lens. Cataracts that develop at the periphery of the lens are referred to as cortical cataracts. Light sensitivity and glare are more common with cortical cataracts. This happens because light is refracted off the wedge-shaped gaps that face the center of the lens. As a result, light inside the eye bounces and scatters, making vision difficult and occasionally uncomfortable. Glaucoma patients may also experience extreme sensitivity. In addition to being uncomfortable, a bright sunny day can produce glare off objects like sand, water, or glass. Number 4. Poor night vision. Poor night vision occurs due to conditions like cataracts or glaucoma that affect the passage of light through the eyes. The tissues in the front parts of your eyes must be clear for light to pass through them properly. When these tissues become opaque or do not allow light to pass through effectively, it restricts the amount of light reaching your retinas, leading to difficulties in seeing in low light conditions. Driving at night or moving around in low light conditions becomes challenging in this situation. Increasing brightness during the day or in well-lit rooms can help improve visibility if your vision is affected. However, it's important to consult with an eye care professional for proper evaluation and treatment if you're experiencing poor night vision. Number 5. Double vision in one eye. One item may appear to be 2 in the visual field due to cataracts and glaucoma. One eye may experience double vision, which makes it difficult to concentrate on one thing at a time. At this time, the eye's lens begins to cloud, which means that the cataract will scatter light entering the eye, resulting in several incomplete images. You will see the second image displaced from the main image of that specific object, rather than a distinct double image. In this situation, covering the affected eye does not make any difference because the condition will remain the same. Another condition that may arise is called second sight. This occurs when the lens expands in the early stages of glaucoma and cataract development. Our eyes are delicate and deserve all the care that we can give to them. Have you been changing your glasses more regularly than normal? If so, then this next sign is for you. Number 6. Frequent prescription changes. As we age, we typically need prescriptions for new glasses every year or 2. If everything appears blurry within a month of getting a new pair, you must visit your eye doctor. This is because there is a high probability that you have cataracts or glaucoma. Cataracts often develop with limited or no symptoms at first. It's possible to have cataracts for years or even decades without realizing it. However, your eyesight may change rapidly once cataracts or glaucoma reaches a moderate to severe stage. The lens of the eye will become more opaque due to the cataract, especially at the center. After some time, the opaqueness will increase to the point where your eyesight appears milky and white. Furthermore, because glaucoma affects eyesight, it is occasionally necessary to regularly adjust glasses prescriptions. With new glasses, better lighting, or other techniques, you can momentarily enhance your vision, but these are not long-term fixes. Surgery may be the only option to stop visual loss as these problems worsen. In addition to identifying these warning signs, doctors can also help carry out tests to detect cataracts and glaucoma. Some of these tests include: Number 1, visual acuity test. One of the first tests that the doctors will carry out on anyone suspected of having cataracts or glaucoma is the visual acuity test. It is basically an eye chart exam, where a patient is given some letters to read from a distance. The whole essence of the process is to check the clarity of your vision. Someone with good visual acuity should be able to see the outline of any object. Most times, high contrast figures such as black letters on a white chart are used to conduct the examination. Although this might seem unnecessary, it actually goes a long way toward determining how clearly an individual is seeing. For instance, this kind of test will tell whether a patient can see street signs or the words in a book. Number 2, slit lamp exam. With the use of a sophisticated microscope and bright light, your doctor can check different areas of your eye. Your iris, or colored portion of your eye, and the lens that sits behind it will be examined, along with your cornea and the clear outer layer. The lens refracts light as it enters your eye, facilitating clear vision. For someone who has cataracts or glaucoma, the doctor would observe an opacity or cloudiness of the lens. Number 3, final exam. Your doctor administers drops to dilate your pupils. The dark spots in the center regulate the amount of light entering. This allows for a thorough examination of the retina, the tissue at the back of your eyes, and provides a clearer view of the condition. Number 4, eye pressure test. Detecting high pressure in your eye is a crucial indicator of cataracts or glaucoma. During an eye pressure test, your eye doctor uses a tonometer device to gauge the pressure within your eye. First, they administer an anesthetic and dye to the front of your eye. Next, they shine a light into your eye and delicately touch its surface with the tonometer. Alternatively, some eye doctors can use a different tool, such as a puff of air, to assess pressure without touching the eye. Getting your eye pressure checked is painless and quick, usually lasting just a few minutes. It's important to stay calm and steady during the test, also called tonometry or applanation. Number 5, gonioscopy. Gonioscopy is a procedure that examines the front part of your eye, specifically the fluid-filled area between the colored iris and the transparent cornea. This region is crucial for fluid drainage from your eye. It helps determine if the area known as the angle is open or closed, blocked, which impacts how fluid drains from your eye. Most times, the anterior chamber angle, where the cornea and iris converge, isn't visible during a standard examination. The drainage angle appears normal, open, and unobstructed in healthy conditions. However, this angle may appear narrow, blocked, or closed in the presence of glaucoma. The eye specialist will assess this measurement during the test. When the drainage angle of the eye is partially or fully obstructed, there's a potential risk of it closing in the future, known as closed-angle glaucoma. This blockage can occur for various reasons, including scar tissue, eye injury or infection, abnormal blood vessels, and excessive pigmentation of the iris. Although gonioscopy does not test for cataracts, it can assist your optometrist in identifying the type of glaucoma you may have. Number 6, visual field test. A visual field test, known as perimetry, detects any areas of vision loss. It measures the extent of your vision and how wide of an area your eye can see. Glaucoma often begins painlessly and primarily impacts peripheral or side vision initially. Changes in the visual field are often unnoticed by the patient until the damage becomes severe. Other conditions like cataracts, stroke, macular degeneration, and diabetes can also affect the visual field. Your doctor will consider these potential influences when interpreting your exam results. During the test, you might see a series of light spots and be prompted to press a button when you can see them. These dots often appear at the edges of your vision, known as your peripheral vision, which is typically the first area affected by glaucoma. If you cannot detect these spots in your peripheral vision, it could indicate damage caused by glaucoma. While cataracts can cause some visual disturbances, they typically do not affect the visual field in the same way as glaucoma. Number 7, optic nerve assessment. In glaucoma, the optic nerve connecting your eye to your brain can sustain damage, so an evaluation might be conducted to assess its health. During the test, eye drops will be administered to dilate your pupils. Your eyes will then be examined using either a slit lamp, which is a microscope with a bright light, or optical coherence tomography, which is a scanning technique employing specialized light rays to create detailed images of the back of your eye. The eye drops used to dilate your pupils may temporarily impact your driving ability, so it's important to arrange transportation after your appointment. A photograph of the optic nerve might also be captured to track changes and maintain a record. An ophthalmologist, a specialist in treating vision problems, should be consulted if glaucoma or cataracts are found during an eye exam. They will verify your diagnosis and assess how far along the illness has come. It will also help to know the potential factors that may have contributed to the development of the condition. If you found this video informative, please click the like button and subscribe to our channel. Thank you, and we will see you next time.